All right, everybody. So I'm going to share my screen and we will get started. Here it is. Okay. All right, you are in. The actual patients make for artificial patients make for actual intelligence. So artificial patients are we're talking about simulated patients, so fake patients essentially. So today for our session, just a couple reminders. I just ask that if you have questions, feel free to share in the chat or raise your hand and I'll see that when I can answer those, I'll answer. Be respectful, be an active participant. You can keep your Zoom camera on so we can see you. Put your Zoom screen in speaker mode, as Emily had said earlier. Mute when you're in the main room, but use the chat box to communicate any other time, and feel free to unmute in this breakout session today. Have lots of fun, ask some questions, and learn something new. So who are we in the simulated patient program? And what exactly is a simulated patient? Well, I'll introduce myself to you. My name is Mary Denmead, as I said, and this is what happened last time I worked with kids. I've been a professional actress for many years. And I was then, because of my acting career, it led me into becoming a simulated patient. And I was a patient for 3 years, and now I am the coordinator, one of the coordinators of the simulated patient program. And the favorite part of my job is working with simulated patients. These are some of the best, most caring, most educated people I know, and I really enjoy my job. So what is a simulated patient then? Simulated patients are real, non-medical people who are trained to realistically portray patient scenarios. They pretend to be sick or injured, and they help medical and physician assistant students practice their skills used when interacting with a real patient, and they offer patient-centered feedback. So when you go to the doctor when you're older, you may think, gosh, this doctor is really making me feel uncomfortable today. And you don't necessarily get an opportunity to share why that is. So as a simulated patient, these students, these medical students, are really getting to hear from the patient perspective how they're doing, so that they can actually become better at their job. Let's see. All right. So today we're going to talk primarily about the communication skills. So simulated patients, I'll go back once. They work with the students for their communication skills. They work on physical exam skills, and they also give that patient-centered feedback, as I said. But today, as I said, we're going to work only on communication skills. So as you see in this picture, there's a doctor and a patient having a conversation, and they're having an interview. We call it the patient interview. So today you're going to meet one of our simulated patients, and you are going to put on your doctor coat, and you're going to pretend that you're a doctor interviewing them, or finding out why this patient came to visit you. So just like a doctor would. And to start that interview, we have to open the interview, and that means introducing yourself. And that seems pretty simple, but today you get to introduce yourself as a doctor. Hello, my name is Dr. Melissa, Dr. Mariska, Dr. Avery. You introduce yourself as you are. The next thing that you're going to do with your patient is you're going to build rapport. Wait a minute. What does rapport mean? Well, I'll tell you. Rapport is a friendly relationship or a connection. This is how it's defined in the dictionary. A friendly relationship or a connection in which the people involved understand each other's feelings and communicate well. So essentially anything that you say or do as the doctor to make the patient feel comfortable, to connect with them as a person on a person-to-person level, and to let them know that you see them as a whole person, not just their illness or not just the reason they came into the doctor's office today. The next thing you're going to do as a part of an interview is establish the chief complaint. So this is the statement or describing the symptom, the problem, or any other reason for a medical encounter. So in order to establish that chief complaint, it's pretty much an easy question. You're just going to ask, What brings you into the clinic today? So I have a good example here. Here's a chief complaint that some patient might come in with. I have got a terrible headache. So when somebody tells you they have a terrible headache, we got to kind of, as the doctor, we have to kind of break that down. We have to tease out all the reasons why somebody might have a headache. It could be they didn't drink enough water. It could be they have COVID. It could be they banged their head on the wall. It could be a variety of reasons. So we have to figure that out. We have to break it down. So what we call that is the history of the present illness. So we have to we got to figure out everything, all the parts around why somebody has a headache. So in medical school is all about acronyms. So HPI is the history of the present illness. And then that's broken down into two parts. There's a couple parts. Today, we're going to talk about old carts first. Old carts, this is at the University of Iowa. It's the acronym that we use so medical students and physician assistant students can have a good idea of what kinds of questions they're going to need to ask the patient. So in your bag, in your box, your STEM kit, you got a worksheet from us. So go ahead and pull that out, and you're going to fill out what the OLD-CARTS stands for. So O in old cart stands for onset. And the question you might ask about onset is, when did the headache start? Then you'll ask them about location. Where exactly does that hurt? Is it in between your eyeballs? Is it all over your head? Is it just that left side of your head? So, so you have to find out, get the patient to tell you specifically where it is. D in old cart stands for duration. Duration means, how long does this headache last? Have you had it all day? Did it start this morning? Did it just come on really suddenly, or has this been going on all week? You got to ask a lot of questions about timing. Character. Can you describe what that headache feels like? So here we really want the patient to use their own words to describe what their headache feels like. Then A in old cart stands for alleviating or aggravating. So those are fancy words to say, does anything make it feel better? Does anything make it feel worse? And R stands for radiation. Radiation means it starts in one place, but does it go anywhere else? Do you feel the pain? Okay, maybe you feel it in your head, but do you also feel it? Does it go anywhere else? Like maybe your neck or your chest or your shoulders or your back. And T stands for timing. What does that headache happen at a certain time of the day? Well, I only notice it in the morning, but by the time I have a cup of coffee, it goes away. Or it wakes me up at night. I feel it worse at night. And then S stands for severity. Now, every single time you go to the doctor, they might ask you on a scale of 1 to 10, where 1 is not so bad and 10 is the worst headache you ever had, where does that fit on that scale? So we get a patient perspective of how much they're suffering with this, the severity of this headache. So I'll just show you a list of all of those in case you missed any of those to fill in. Because these are all little pieces of a puzzle that you're going to gather from your patient to figure out why they're not feeling well. And the next part of the HPI, taking the HPI, is the Icy questions. We call these the Icy questions. And these are my favorite questions that we get.
Can you tell me what the O is for again? Like what the question
is onset. Onset.
The question for O in the example.
Oh, the question for O, when did it start?
Okay, and what about A?
A is there anything that makes
yeah, A.
or worse? What?
Yeah, A.
A is alleviating or aggravating. Was there anything that made it better or worse? Makes that headache feel better or makes it feel worse? All right, good questions. All right, I'm going to keep going. So Icy questions. These are the patient perspective. So do you have any idea what's going on? What's your biggest concern today? How is this affecting your life? And what do you expect from me today as the doctor? So when we ask a patient these reasons, these questions, we usually go to the doctor when we're feeling some sort of emotional disheveled, something's making us upset. So so I'm really worried that this headache is it a brain tumor? That's what I'm really concerned about. Or I can't go to work this week. So this is really affecting my life. So we really want to get the patient's perspective of how this is affecting them. All right. So I'm going to let you guys, you can unmute if you want and think about what other questions you might want to ask a patient. Can you think of one or two other questions that you might want to ask? And you can feel free to put those in the chat or unmute and share. What other information is important, do you think, to ask a patient? And Sarah, if you're seeing anything in the chat, would you just kind of give me a heads up? I can't quite see my chat right this minute. Maybe you can't either. All right. Well, maybe these questions will pop up as we go along. If you want to unmute, you can share those with me. All right, let's keep going then. The last thing is to think about is how, as you, the patient, how would you want to be treated? Do you want somebody to talk kind of down to you and make you feel kind of, well, you shouldn't have that headache, kid? Or, well, you probably should have drunk more water and then you wouldn't feel so bad. Or, so we don't want to be treated like that. We want to be treated as something, we want to be talked to in a way that makes us feel heard, in a way that makes us feel supported, in a way that makes us feel confident that this doctor is going to help us today, right? That's what we want to think about. So just essentially thinking about being a person talking to another person. All right, so now it is practice time. Now you get to interview a simulated patient. I want you to keep your camera on and please unmute so that we can hear you, because you really actually have to ask the questions with your microphone. You get to introduce yourself to the patient. One or two of you can do that. You're going to be a doctor today. Use those sheets to interview your patient and get the information that you need to help her. I'm going to be I'm going to shut my camera off, but then I'm going to be popping in from time to time to sort of help you in the questions that you're asking. So today, our patient is Sarah Jewell. Now, Sarah Jewell has come into your clinic today. You can see her there. She's come into your clinic today because she is experiencing some serious knee pain. She's complaining of pain in her knee. So I am going to mute. I'm going to
Mary,
my share.
I'm only seeing your share screen.
Yeah, I'm going to stop my share in just 1 second as soon as I can get that back up. There it is. I'm going to stop my share and hopefully you can see everybody now. Yes? All right, good. So I'm going to spotlight your video, Sarah. No, I guess I'm not. All right, there you go. All right, and I'm gonna shut my camera off and I'm gonna have you guys go for it. All right. So ready? Good. Who's ready to? Good, excellent, Avery, thank you.
How long has this been happening?
Oh, I'm gonna pause you. Did you introduce yourself yet?
Oh no.
Go for it.
Hi, I'm Dr. Avery. What brings you into the clinic today?
And I'm Dr. Gupta.
Oh, hello. I'm so glad that I could get in to see someone so quickly today. Thank you.
What do you feel today?
Excuse me? What did you say?
What do you feel today?
What am I feeling? Oh, I have my knee is really hurting me today. Yeah, it's really bad.
When has this been happening? When did it start?
It started about 2 days ago. I was outside, I was refilling our bird feeders and I bent down and right when I was getting up, I twisted and turned and I felt something pop and it just was this immediate pain that I felt.
Is it in your right or your left knee?
It's in my right leg. Yeah, my right knee.
Has this been happening like at a certain time, or has this been happening like constantly?
The pain has been constant. And it's the first time that I've had this happen.
I know.
Do you feel it
And-
anywhere else in your body?
You know, I am starting to feel it in a little into my back hip. And that's just been since this happened too, when I've been, I think, trying to walk, and I'm like, oh, now my hip is hurting.
Does anything, when you try anything, does it help you feel better at all?
Well, I've mostly been sitting at home just with my legs straight out. But I have tried taking some ibuprofen, and that has helped a little bit. At the very beginning, when I bent it, it seemed to feel a little bit better.
Um,
How would you rate your pain on a scale of 1 to 10? 1 being not very
One-
much pain and 10 being
and
the
10
worst
being the
pain.
worst.
Oh, I would say maybe it's about a 6.
Have you talked to any other like doctors or any other family members about this?
Well, just my husband, because I'm a little worried. My husband and I have a computer business, and I'm trying to figure out how I'll continue to go to work. So he knows about it. Otherwise, I haven't gone to any other doctors yet.
I'm going to pause you for 1 second. You guys are rocking it. You're doing great. You're asking all the right questions, right, Sarah? I think you're getting a lot of information, right? You're finding out about when it happened and how long it's been happening and how much pain she's in. Now, she told you, I'm just going to point something out. She told you that and first of all, look at her face. What do you see in her face when she's talking to you? What, Avery?
A frown?
She's frowning, yeah. Do you think she's happy right now?
No.
Do you think she's in a lot of pain right now? Okay, so how do you guys want to feel when you feel like you're feeling sad or worried or concerned? What kinds of responses do you want from like mom or dad? Or your
Maybe
teacher?
some sort of coaxing response.
What kind of a response?
Coaxing. Wait, what's it pronounced? Let me just type it. I don't know what it's pronounced.
Okay. Coaxing response. So that means like what? Coaxing means you're kind of trying to get them to talk more.
Yeah, and a little bit of
So you want to help her feel relaxed. That's a good point. Good. So what kinds of things would you do to help her feel more relaxed? She really looks worried. What kinds of things could you say?
You could tell her that we're going to help her with this.
Oh, Avery, that's beautiful. Yep. What else? How would you go ahead and say that to your patient? Let's see how she feels when you say that to her. Let's see what she says.
We're going to help you deal with this knee problem.
Oh, thank you. I just didn't know if I should come here or where I should go. So that brings me relief if we can figure out what's going on with this.
we're in this together.
Oh,
Thank you. Thank you. I really appreciate that support.
guys, that's awesome. Look at what you're doing. You're treating her like a person and you're really making her feel better. I can see it in her face and hear it in her voice. Really nice. We're in this together. What a wonderful thing to say. And making sure that she knows that you're going to help her. That's beautiful. Awesome. All right. You want to keep going? Got other questions?
Do you remember the posters back in 2021? like back in 2020 or 2021 saying that we are in this together and stuff like that because of COVID.
Yes, and that made you feel pretty good, didn't it? To know that like you're not alone. And
Yeah,
that's really what
that's what I
patients
tried
want
to
to
do.
know. They want to know that they're not alone. They want to know that they have help. Did you say something else? Did I talk over you? No. Okay. All right. So you guys are doing great. You've got pretty much almost all of the old carts questions, but
And
now we want to kind of let our patient know what we've heard. So can we give her a little summary back of what you've heard? Why don't you take that, Avery, or? Oh, they're going to close our breakout room. I see in about 9 seconds. So you guys did a great job. And again, remembering that it's just two people having a conversation, right? And you're going to help them.
All right. Hey, everyone. Hope you are enjoying your first breakout sessions. And I apologize for some of you. We did have some technical glitches. So thanks for your patience in that first session. For any of our presenters,